have the opportunity ahead of us to get to the root of some of the most intractable health and public health problems our nation has faced.
The healthcare industry in the United States seems to focus on measuring what it can do and what it has done. And there's not enough of thinking about what could be.
You can't innovate unless you bring together people that have deep knowledge in many different areas. Working together, they can find more answers to big problems.
There are so many different views coming together, and we have a really good mix of people on stage and off stage.
In order to really achieve whole-scale transformation, we have to work at this deeper cultural level, and we have to engage this idea that health and healthcare are synonymous, because the evidence tells us it's just not true.
We need to stop trying to fix a broken system. We are missing the point. It's time to take the opportunity to understand the ever-changing and evolving needs of people and allow that to make the system stronger.
Bridges don't have anywhere to go. It's the people that cross them that do. And I think ultimately we spend a lot of time thinking about the bridge and not as much time thinking about the people that are crossing it into better health, potentially out of health, and wanting to come back.
I think back to the doctors that have included themselves on my story. They haven't just been fixers, but they've joined in on this story as a guide or as someone following with me.
The most effective innovators are the ones that can make the most compelling arguments. You cannot make such a compelling argument utilizing data in a scientific fashion.
When you have a conference that's designed around a multidisciplinary discussion, there are going to be some discussion that you go, this is a bell that's never been rung for me. This is exciting.
This is not a sit back and listen kind of conference. This is a sit up and engage kind of place.
We get to see health as a broader thing as it relates to how we live. I think is a very fascinating approach. How do we engage with patients and families about receiving the best care possible through understanding their values, preferences, and priorities for medical care? That's transformative in and of itself.
Unlike other conferences, the conversation that's going on stage continues out here.
In between the sessions, you get to network and expand the network of people.
I get to interact with people who can make a difference, who can take those words and put them into action.
We have learned that our communities have a lot of needs, but needs do not change communities. Our strengths, our passions, our talents change communities.
This is not about transforming one thing. This is about transforming ourselves. This is about transforming the society.
The audience I find here they're energetic, they're passionate, they want to make a difference.
I'm incredibly psyched to be here.